So fibroids are also called as leiomyoma, uterine leiomyoma. They are benign, smooth muscle tumors that occurs in the muscle of the uterus. Most of them may not even know that they have, but however, some of them do have heavy periods, painful periods, and pressure symptoms that warrants investigation where they find that they have these benign masses. They are not cancerous. They are non-cancerous growth that is picked up in the muscle of the womb, and they usually undergo slow growth and can cause symptoms. It's very common, and it is estimated that it presents mostly around the age of 30 to 40 years, and it is found in at least 20 to 50% of women presenting with heavy menstrual bleeding and other symptoms of intermenstrual and pelvic pain. And it is also noted that it is found in more in Afro-Caribbean women, and family predisposition is highly noted. So genetic predisposition is also been linked to the presence of fibroids. It's not usually known what causes fibroids or what trigger the growth of fibroids or formation of fibroids. There's a predisposition to genetic conditions, like it's found that women in the same family tend to have fibroids. So there is a link with genetics, and also excessive prolonged exposure to estrogen is found to stimulate the growth of fibroids. And the common factors we see is pregnancy can trigger the growth and may initiate a small growth of a tiny fibroid that is there. Family history of fibroids, again, as we previously discussed. Age itself increases, like women who are in their 30s or older are at increased risk of developing. Afro-Caribbean community, as well as high body mass index. That's because of excessive estrogen that stimulates the growth of these benign tumors in the muscle of the womb. Normally, when someone has fibroids, some of them may not even know that they have fibroids. It's usually when you have some other investigation, like a CT scan, MRI for a pelvis or a bladder problem or something very different. You have a scan and you will identify that there is a fibroid. So it is an incidental finding. However, some of them presents with heavy menstrual bleeding and abdominal pain, pelvic pain, and if it is pressing on the bladder, it causes increased urinary frequency. If it's pressing on the bowel, it can cause constipation. And if it is stretching the pelvis, it can cause discomfort as well. And sometimes, depending on where it is present, whether it is in the lining of the womb or in the muscle of the womb or outside, it can cause a bleeding like intermenstrual bleeding and excessive vaginal discharge. Sometimes you see these fibroids prolapsing through the cervix, where you could have a lot, you may have a lot of abnormal discharge as well that warrants an examination, and they find that there is a prolapsing fibroid. And some of them may present very late with anemia, and that's how we know that they have fibroids. So the main thing is about how it affects someone if it is long-standing. So for instance, I'll take an example of heavy menstrual bleeding. If women are bleeding quite heavily, then the risk is that they become anemic. When they become anemic, they start having symptoms of anemia, like feeling generally tired, they have palpitations and dizziness, and unable to perform their day-to-day activity. Hence, it affects their quality of life. Hence, that's the biggest symptom that we see. When it affects the quality of life, treatment is needed and to correct all the symptoms that they present with. However, we also see that fibroids can have an impact in pregnancy, depending on the size and where it is present. If it is distorting the cavity, women can undergo miscarriage early in their pregnancy because of poor implantation. Sometimes it can cause recurrent miscarriages as well. It can cause pregnancy-related changes like malpresentation of the baby, increased cesarean section rate, increased instrumental rate, baby head unable to go into the pelvis, or what we call as degeneration and changes in pregnancy leading to increased admissions, as well as PPH, what is postpartum hemorrhage, which is the bleeding after having a baby because of increased vascularity in the womb. Also, it can cause subfertility. When it distorts the lining of the womb, women may find it difficult to conceive because of poor implantation and receptiveness in the lining of the womb. So it can cause various symptoms from menstrual disorders leading to anemia. It can cause problems with subfertility, miscarriages, pregnancy-related complications, and postpartum complications. However, the reassuring thing is after menopause, it tends to stop growing and it also causes less symptoms. And sometimes you'll see the symptoms get better as you get into menopausal age. Treatment is only needed when they are symptomatic. I've detailed all the symptoms that you normally have. When they have any comorbidities as a result of these symptoms, and if it affects the quality of life, is when you get a treatment. If it's an incidental finding and hardly women have any symptoms, you don't need to have any treatment, nor you need any monitoring. And this is a common thing that women ask, should I monitor my fibroids? Would it grow quickly? It's very unlikely that it grows faster. However, if it causes symptoms, we address the symptoms. And sometimes women do have pressure symptoms. So it might be making them feel very bloated, very heavy, and you may feel pelvic masses because it's grown into the abdomen. It causes pressure symptom on the veins, causing thrombosis and DVTs. So you address those symptoms. If it affects other organs, like pressing on other organs, and affects the performance of those organs, and you think that this could be causing problem with venous stasis and other things where there is higher risk of comorbidities, then you probably would advise the women to have surgery to relieve the pressure as well as reduce the size of the womb and help with their symptoms. Treatment could be to do nothing, conservative approach, or you go for medical management to address the symptoms of menstrual disorders, or you go for surgery, including removal of the womb, which is hysterectomy, removal of the fibroids, which is myomectomy, or hysteroscopic removal of the myomas, which is the fibroids. And last but not the least, embolization is also a known treatment, helps with the reduction in the size of the fibroids. So there are various, and there is new technology that is coming in as well that would in future reduce surgical intervention and morbidity.